Hello, good evening, good afternoon, good morning and welcome. It's Nurse Richard, the Wax Wizard. At the end of this procedure, the end of this ear here, you're going to see something really strange. And I know you like things that are a bit out of the ordinary. And what you're going to see in this gentleman here is, hence the title of the video, a weird pulsing eardrum. And you're probably thinking, why is that? I will try and explain that in a bit. But first and foremost, we've got to get through to the eardrum to start with. Because this chap, other than not being able to hear very well, he didn't have any symptoms at all. Just had a bit of skin and wax in both of his ears, both pretty blocked up. And when we removed that, he reported being able to hear again a lot better, pretty much straight away. But it was an odd one, this, and it wasn't easy to spot. And again, that's the good thing about these endoscopes here is ordinarily you might not be able to see this because it's a really small pulsing area. You might already be able to see it. It's just in the just to the centre right of the eardrum, as you can see it. I'm going to zoom in a second. Just going to get rid of that little speck there. I'm not getting involved in a peel there. There's absolutely no need. So I'm going to zoom in here, and can you see that pulse in there? You're probably thinking, as was, well, I kind of knew what it was straight away, but there's a couple of things you can do to confirm it. So yeah, you can see it pulse in there. Now what I'm going to do in a second, I'm going to ask the patient to stop breathing just for a short time, and you'll see it stops. Can you see there? It stopped. Then I'm going to ask him to start breathing again, and it starts again. And you might be thinking, some of you will know what that is, and that's called it's a patulous eustachian tube. For those of you who don't know, what is that? That is, let me, can I explain it? So the eustachian tube is a tube that joins the back of the nose to the middle ear space behind the eardrum, and that's job is to regulate the air pressure in the middle ear. So normally it's shut, and every now and then it temporarily opens just to allow air to come in through your nose to fill that space behind your eardrum, so it makes sure that the air pressure is the same in the outer part of the ear, i.e. this side of the eardrum. Make sure it's the same on the inner part of the ear, which is the middle ear behind the eardrum. And in patulous eustachian tube, that it's open basically, so it means that there's no regulation of the air pressure. You know, it doesn't open and shut to allow in low air in when it needs to. It's constantly open. It can be a temporary thing, can be more of a permanent thing. There are a few causes. And the symptoms that a lot of people often report when they have this is, I've heard it described like having a bucket on the head, or you can hear your own breathing and your own voice inside your head kind of echoing. This chap didn't have any of those at all. No symptoms whatsoever, and it wasn't happening in this ear as well. So I have asked his doctors to have a quick look at this, but as it wasn't bothering him at all, to be honest, what they'll do, I'm not entirely sure. That would be their call. I believe one of the most common causes is weight loss, because I think it's around a third of cases that's found to be the issue. And because there's obviously there's fatty tissue around there, and if there's less fatty tissue, it doesn't shut as well. I'm not explaining this very well, am I? If there's basically less stuff in there, it's more likely to stay open. Other causes can be, I believe, caffeine, exercise, some, I believe, pregnancy, something to do with hormones. That's certainly not the case with this gentleman. I very much doubt it anyway. It's a fabulous operation if it was, and it's a medical miracle because of his age. But more often than a lot of the time, the cause is unknown. And there are some things they can do. Some nasal drops help. Some surgery helps in some extreme circumstances, I believe. But more often than not, they don't tend to do anything about it unless it's causing some severe symptoms. And it wasn't in this gentleman, but I have asked it to be investigated. Because you can see, this one, it's not doing it at all. So yeah, weird pulsing eardrum. I hope you enjoyed that, found it interesting and a bit different. But for now, take care of yourself, and I'll see you soon. Ta-da.